Hello and welcome to the Motivational Midwife. My name's Lynn Jones, and in this video we're going to look at the assessment station of the NMC OSCE. So I was asked to do the assessment station, which is the API, part of the API station in your OSCE. We have kind of done it in the way that they've been done, just purely because of the way people have asked me to do the videos. But you now have all four parts of the API within these videos. So the order they will go in, they make up one station, so it will be assessment station, planning station, implementation, and your evaluation station, and that would be your API station. Takes about an hour all told for that station. So we're going to go through what's expected, and we'll use the antenatal scenario that we used for planning as well, just so that there's a bit of continuity in there. But equally, you could get a scenario that is intrapartum. You could get postnatal scenario. Your process will be the same. Okay, so the scenario, which, as I say, follows through for your planning one, is that you're on the antenatal assessment unit. You've been asked to assess someone who's come in with a vaginal bleed at term, and the midwife that's brought her to you tells you that she's 38 weeks and it's her second pregnancy, and she tells you that she's had a small amount of fresh red blood loss and some abdominal pain, and she does look in pain when you're looking at her. So her history, and remember, you'll be given that history potentially on a sheet. If you're not, you're going to be asking the questions to actually ascertain what her history is. So she had sexual intercourse at 7:30, so that would immediately make you think, is this a post-coital bleed? Potentially, but you're going to have to rule out everything else as well. She's had pain since 8:30 and a small amount of fresh red loss on wiping and some staining on her underwear about an hour later. She lives with her husband and other child. She's an ex-smoker. Obstetrically, she had a normal delivery in 2015. She's been under consultant-led care. In this pregnancy, she had a low-lying placenta at the 20-week scan, but that was clear of the OS at 34 weeks, and she's had normal growth. She's Rh negative, and she had anti-D at 28 weeks, and she did have postnatal depression following her last child, which was resolved with counselling. She didn't need any medication. She's had unexplained infertility after the last child, and this pregnancy was an IVF pregnancy, hence why she was under the consultant. And medication-wise, she's been on iron tablets, and she's got an allergy to codeine phosphate, where she'll get severe nausea and vomiting. So let's look at the marking criteria first then. So you're going to assess the scene for the safety of the scene. So as you enter the room, you're going to enter the room and verbalise to your assessor, on entering the room, I'm checking for scene safety and I'm maintaining the privacy and dignity of my lady by drawing the curtains. Okay, so that was going to deal with point one. I'm then going to clean my hands in line with WHO guidelines. So that will be use the alcohol rub, or I suspect for your OSCE it's more likely to be alcohol gel, not a sink and soap. But so you have to verbalise palm to palm, dorsum to dorsum, fingers interlaced, fingers interlocked, tips to palms, thumb rotations, and wrist rotations. Okay, and then leave to dry. So you have to verbalise those steps of hand washing that follow the WHO guidelines. And then put on disposable apron and gloves. Introduce yourself to the woman. So, hello, I'm Lynn. I'm the midwife that's going to be looking after you today. Can you just tell me your name and date of birth, please? Okay, so she needs to verbalise. Don't say to her, oh, you're Amy Hall, because actually in real life, that's not what you would do. You need to ask somebody to actually tell you their name. If English is not their first language, they may say yes when they don't really understand what you're saying. This potentially, certainly from a drug administration point of view, could be quite detrimental, but equally you could be then have the wrong history for the wrong woman, or the right history but the wrong woman. So you must get them to verbalise their name and date of birth. If she has a hospital ID band on, then also check against the wristband. So you would just say to your mannequin, because it's unlikely you'll have a real person, that'll be a mannequin, just say, do you mind if I just check that with your wristband? And then out loud say the woman's name, date of birth and hospital number if it's there. And then while you're there, check the colour of the wristband. So in most trusts, allergies are denoted by a red wristband or some sort of red tag on the ID band that highlights that they have got allergies. So you can say, do you have any drug allergies? And then you can actually verbalise, I can see you're wearing a red wristband, or if she's not wearing the appropriate coloured wristband, you can say, oh, I can see you're not wearing a red wristband, I will get that changed for you. So it's about highlighting that you recognise that actually if she's got allergies, she should have the correct colour wristband on. And then you need to review the history. Okay, so you're either going, if you've been given the history on a sheet of paper like this, then you're going to be confirming that history with her. If you have not got it, then you are going to be writing it down as you go. Okay, so confirm the situation. What's brought you in here today? So then she's going to tell you about her bleeding and her pain. You may have to explore that a little bit deeper depending on the situation. So, you know, how much blood? What colour was it? When did the pain start? How frequently are these pains coming? How long are they lasting? Where are you feeling them? So dig a little bit deeper so you're getting much more information from her. Have you got any other loss vaginally? Okay, so you are asking about those presenting symptoms. Okay, is this your first baby? Or if you've got the history in front of you, so can I confirm this is your second pregnancy? And can I confirm that you're 38 weeks pregnant? Okay, so parity gestation, and we've talked about the pain as appropriate. Okay, then you're going to confirm her background. So remember that SOMAD, an acronym that we used. So her social history, her medical history, obstetric history, and any medications that she's on. So, for example, can I, in terms of medical history, can I confirm you had postnatal depression following your last baby? And can I confirm this baby was an IVF pregnancy? And your first baby was a normal delivery with no problems, you know, no excessive bleeding. You're just confirming those things. And then you're going to accurately perform your set of observations, which I'll come on to shortly. And you'll do your maternal observations, and you'll do your fetal observations, as well as your urinalysis. Okay, so at the moment you've got gloves and apron on. My personal advice would be do your urinalysis first. Okay, so with the urinalysis, you need to do it for a whole 2 minutes. So you need to, very much like the medication station, you need to check that your uristicks are that the bottle is intact and sealed, that they are in date, so that you have to verbalise they expire on whatever the expiry date is. You take one strip out, put the top back on. You check that the urine in the sample that's been given to you has your patient's name on it and date of birth, so you can say, I can confirm that this urine belongs to Amy Hall, date of birth, etc., etc. Okay, test your urine. You're going to have to test it for 2 whole minutes. Okay, so read and verbalise to your assessor that you are going to read the results in accordance to the manufacturer's instructions. Then hold your stick, dip your stick in the urine, and then wipe off the excess, hold it against the card to read it off on the urine pot, on the URI sticks, and then make sure you've looked at your watch as soon as you've dipped it. So then say 30 seconds glucose negative, and then go through the whole thing. So 30 seconds, 40 seconds, 45 seconds, 45 seconds, and so on and so forth, reading all the results off, and say what you actually get on your stick that's in front of you. If it's negative, say negative. If there is something on there, then say exactly what it is. Your assessor, when you ask for the results, will give you what results they want you to have. Then dispose of that pair of gloves and apron, re-sanitize your hands, and then put on fresh gloves and apron. Ask your assessor if your equipment is all clean, calibrated and ready for use. Then gather up your equipment to do maternal observations and go back to your patient. Gain consent to, so just say, what I'd like to do is undertake a full set of observations. You can actually gain consent for all of this right at the very beginning before you go and test your urine by saying, what I'd like to do is undertake a full set of observations of on yourself. That's temperature, blood pressure, pulse, respirations, capillary refill and oxygen saturations. I'd like to do an abdominal examination where and I'll measure the symphysis fundal height, also palpate and auscultate your baby's heart rate, if that is okay with you, and she'll say yes. Okay, when you're undertaking your maternal observations, make sure that you verbalise everything you're doing. So with the thermometer, you will say it's quite likely to be a infrared one, so you'll say, I'll hold the thermometer 3 to 5 centimeters away from the forehead. Take that. I will put my blood pressure cuff, the correctly sized blood pressure cuff, 2 to 3 centimeters above the antecubital fossa, and you're going to put it on the mannequin's arm and undertake the blood pressure. Okay, I'm going to put do my capillary refill, and so verbalise as you're doing each observation, verbalise exactly what you're doing. Then when you've done all those, with your abdominal examination, then do your symphysis fundal height first, so that will be from the fundus to the upper border of the symphysis pubis. Do your abdominal examination and verbalise that you are doing lateral palpation. So you're going to find your fundus first, then you're going to do lateral palpation to determine the lie and position, and you're going to do pelvic palpation to determine your presentation and descent. And then you will auscultate the fetal heart with a pinard. Make sure that you take your hand off the pinard. I've just got pinard here. So when you've got it against the abdomen, take your hand away, and with the other hand put it on the maternal pulse, so that you're differentiating between fetal heart and maternal pulse at the same time, and verbalise that you are differentiating between fetal heart and maternal pulse. Then it comes to documenting. Okay, so make sure that you complete everything on that meows chart that you've filled in. If it's not already pre-populated on the patient's name and date of birth and hospital number, do that. Put the area that you're working in, put the date and the time in the appropriate box, and then chart the results appropriately. Okay, it is useful to learn what the parameters are for maternity in the UK for the meows chart. They are different to non-pregnant people. Make sure that you sign and date, and that you put what your scores are, your yellows and your reds, and how frequently that you are going to undertake those observations. Okay, so throughout the assessment, you need to have clear communication, and that you need to be talking to that mannequin exactly the same as you would for a real live person. And then you can verbalise that you will dispose of your gloves and apron and re-sanitise your hands. Highlight any observations that are a cause for concern to the examiner. So you may do that really to the woman. You might say, right, I'm a little concerned about your pain level, and she might have a slightly raised pulse, something like that. So you're going to actually say, I'm a bit concerned about the pain level and the raised pulse, and also obviously you've got this bleeding, so I'm going to, and whatever. Just, you don't have to give a whole long all of your plan of care, but just highlight those and give a brief overview of what you're going to do, so that the same as you would for a patient. So that might be, I'm going to get the doctor to come and review you. Okay, that you can say that, as little as that. Okay, the key thing is really to highlight those observations, if there are any, that you are concerned about. Okay, so when you're taking the history, if you haven't got it written down in front of you, remember you're going to ask her social history. So, you know, does she smoke? Has she got any alcohol concerns, drug concerns? Does she live with a partner, other children? Then her obstetric history, so that's past pregnancies and the current pregnancy. Any medical conditions, any allergies, and any medications she might be on, drugs or medications. So we've got that history we've already talked about. And then, as I've said, this is what we want to do, that hand hygiene, urinalysis, hand hygiene and change your PPE again, do your observations, do your abdominal examination. Document everything on the meows chart, highlight those key concerns to the patient, and dispose of your PPE. And there you have it. That's the assessment station for NMC OSCE. I hope this has given you a better understanding of what's expected of you during your OSCE. Good luck when you undertake it. And if you haven't subscribed to the channel already, please do so, and find us on Facebook at The Motivational Midwife. I look forward to seeing you next time.